So we are going to finish off our overview of what an IVF cycle looks like by looking at the very last phase, which is luteal phase support. Luteal phase support happens after the embryo has been transferred in, and it essentially the giving of medications to support the pregnancy. Now, to understand luteal phase support and why we need it, we probably need to talk a little bit about the actual luteal phase itself. The luteal phase in a 28-day menstrual cycle is the last 14 days. It commences after ovulation and ends with the period. Several things happen to the endometrial lining during the luteal phase. So prior to ovulation, the lining was actually very much what we call proliferative in nature. It built up in thickness by cell division. That stops with luteal phase. In the luteal phase, the cells themselves get bigger, but they don't increase in number. They change their nature in the way they secrete more glycoproteins that nurture the embryo, and they actually start to develop what we call spiral arteries at their base, which then is a precursor to the embryo implanting. Of course, the main function of the luteal phase 2 is to accept an embryo, to facilitate essentially embryo implantation. It is a bit of a common misconception that the entire luteal phase is receptive to the embryo, when in reality the window in which the embryo has to implant, appropriately named the window of implantation, is really only sort of 24 to 48 hours, maximum 72 hours. And that window opens up roughly about 5 days after ovulation. Now, the luteal phase is so called because it's named after a structure called the corpus luteum. Literally called the yellow body, the corpus luteum is the shell of the follicle as it erupts and ovulates the egg inside. So once an egg leaves the follicle, the shell that it leaves behind is not inert. It undergoes change to itself and becomes actually quite an active hormone secreting organ. The main hormone that it gives, or that it secretes, is progesterone, but it secretes a whole bunch of other stuff. Everything in it is about supporting the pregnancy. So it is these hormones, mainly progesterone, that gives the signal to the lining to change and to open up that window of implantation. So that's actually what a luteal phase is. So why do we need that in IVF? I think the important thing to understand about IVF is that the luteal phase in IVF is either non-existent or completely changed and aberrant, so that we need support. That is the price to pay for IVF, that the luteal phase is irredeemably, irrecoverably changed. It's changed because the high hormones that we produce via IVF, it's changed because of the change in brain signaling that we induce with IVF, and it's changed because as we do an egg retrieval, we actually damage the corpora lutea as we collect the eggs. So in supporting the luteal phase, we can do this via two methods. We can support the corpus luteum directly, so support the shell of the egg directly, or we can replace what the corpus luteum would secrete, which is progesterone. If we talk about the first method, this is mainly using a hormone called HCG. It is the pregnancy hormone, and it is also mimics a hormone called luteinizing hormone, LH, that we've come across before, that supports the corpus luteum. By giving HCG shots after the egg has been retrieved, we manage to keep all the corpora lutea alive and functioning. It's reasonably effective, but does actually have a risk of ovarian hyperstimulation. The other method is to give progesterone. Progesterone is the main hormone that the corpus luteum produces, and therefore if we have a non-functioning set of corpora lutea, then we will need to replace what they secrete, which is progesterone. The main method for giving progesterone is vaginally. There are really nice, elegant studies that show vaginal progesterone have really good effect in that they get absorbed first via the vaginal vessels into the bloodstream and into the cervix, and via the blood vessels in the cervix it can get sucked up and absorbed by the lining, and that's actually where we want the progesterone to be. We want the progesterone to be acting at the lining. It can be given in the form of a cream, it can be given in pessaries. Most of the data that looks at the efficacy of progesterone in terms of supporting the pregnancy under IVF is done using vaginal progesterone, whether it's creams, gels, or pessaries. There are other forms of giving progesterone, so you can give it subcutaneously, just as like an injection under the skin. In Australia, there's only one product for that, it's Prolitex. And there in overseas, we can get deep intramuscular oil preparations of progesterone. These are definitely not shown to be more effective than vaginal progesterone. They're used as an alternative for people who don't like giving vaginal progesterone, or as a supplement to vaginal progesterone as well. There are some studies that say that intramuscular progesterone is not as effective as vaginal progesterone. And intramuscular progesterone preparations do have their own side effects, and mainly because there's quite a deep, viscous, thick oil that gets injected. It can cause pain, it can cause some bleeding, and it can cause abscesses deep in the muscle as well. Their use is that intramuscular progesterones don't need to be given every day, so they can give one shot and it'll last for about a week. You can also give progesterone via oral tablets. The issue with oral progesterone tablets is that a lot of it gets metabolized by the liver. So in order for you to use oral tablets alone and not use any vaginal pessaries, then you need to give a lot of it. And when you give a lot of it, that's when you get some of the side effects of progesterone, such as mood changes and breast swelling and appetite changes as well. So progesterone supplementation is probably in Australia the mainstay of luteal phase support, and this is really the final step of the IVF process. So you start that really from the egg collection. It's there to support any pregnancies and embryos that are implanting, and then we don't really stop it until at the very least a pregnancy test. So I hope you guys have found this very useful, just as an overrun of what happens during IVF. Obviously, this is a really brief overview, and there's a lot of detail to each of these steps, and your doctors and clinics can go through that with you.